So this is the relaxed position. Always the muscle should be in the relaxed position while doing the needling. Okay. So this is the relaxed position for trapezius. You have to place your forehead over there. This is the relaxed position for upper trapezius. Otherwise, you can go in the prone line with the one hand over the position. So these are two positions. The patient comfortable with this position, you can make them this position for upper trapezius. So patient position, therapist should stand side of the area where they are treating this region. So don't stand by this side. So this is the area, you have to stand this side only. I am going to use the needle. For the trapezius, we are using the 1.5 inch needle. The patient is very lean, you can go with the 1 inch needle. For normal ideal people, you can go with the 1.5 inch needle. That is 0.25 into 0.25 is the 1.5 inch needle. So this is the 0.25 into 0.25 is the 1.5 inch needle. Okay. Two needles we are going to take. So first we have to place the needle over the trigger area. Okay. Trigger area. With the dominant hand, I have to go into relieve the guide tube. I remove the guide tube. Okay. With the non-dominant hand, I am holding the guide tube now. Now I am going to tap with the index finger with the dominant hand. So, for the upper trapezius, what we have to do? We have to grasp the muscle. I told you we have to grasp the muscle. So, grasping at the borders. With the non-dominant hand, we have to grasp the muscle. This is the border, so we have to grasp the muscle. Okay, with the dominant hand, we have to do the needling. 1, 2, 3. Now removing the guide tube. Okay. Removing the holder, grasping the muscle and tapping over the needling. Now we have to do the stimulation. So this is the spincher grasp. Okay, I am doing the stimulation clockwise as well as the anti-clockwise. The angle is 90 degree. It is perpendicular to the muscle fibers. Okay, so the angle is 90 degree. You should be directing perpendicular. This is the muscle fiber. The angle is 90 degree. So this is the technique for upper trapezius. The same thing we have to do for another lateral trigger point. Placing the guide tube, removing the holder. With the non-dominant hand, we have to hold. Don't do like this. You have to grasp the full muscle. This is the bulky region. Grasp the muscle, and with the dominant hand, index finger, we have to tap over the trigger area. 3 taps you have to give. Don't tap little. Make a firm tap. Okay. Then you have to give mild pressure along with rotation at the first time. Clockwise and anti-clockwise stimulation. Then only you have to remove the non-dominant hand. Till then you have to grasp the muscle. Till stimulation. For every stimulation, I will grasp the muscle and do the stimulation. This is clockwise, anti-clockwise. Clockwise, anti-clockwise. So 1, 2, 3, 4, 5. So 5 times you have to do for every 5 minutes. Then we have to remove the spincher grasp with the non-dominant hand. Okay. This is the technique for upper trapezius. So in which conditions we can do the upper trapezius? Yeah, trapezitis. See, after the technique, the needle should be perpendicular. Angle is 90 degree. It should be 90 degree perpendicular to the muscle fibers. Okay. So we can use it for trapezitis. So in either condition, in what conditions we can treat the upper trapezius muscle? Yeah, trigger point, okay. Any conditions? Cervical spondylosis, trapezitis, then disc problem. Cervical disc bulge, cervical neuralgia. Okay. What is the next neuro problem? Cervical disc bulge with C5, C6 involvement. Okay. Then Erb's palsy patient. Erb's palsy. Erb's palsy is where they are having the involvement of C5, C6. So upper trapezius will be tightness, and patients with rounded shoulder. So they have the tightness in the upper trapezius. Who are having the kyphosis, they having the upper trapezius tightness. So these conditions we can treat the upper trapezius. Okay. So you can use the multiple conditions for the upper trapezius. So what is the two trigger points? Medial one, lateral one. First mark the muscle, mark the trigger point in the anatomical sitting position. Okay. Then make the patient position. Place the 1.5 inch needle and grasp the muscle with the non-dominant hand. The dominant hand remove the folder, then do the tapping